Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, welcome back to Healing Families Shattered by Addiction. I'm Di McQueen and I'm here today with Dr. Brian Jackson, and we're going to talk a little bit about what addiction is in simple terms and then explain so that the average person can understand what addiction looks like a little bit easier and how this it affects families as well. So let me start by defining exactly what addiction is. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. So, this is one of those things, and Brian and I both happen to believe that this is a disease. So that being said, Brian, why don't you help us, as you are a doctor of addiction, with the understanding of how this all works in the brain itself?
Well, thanks, Di. It's great to be here with you today. And I think it's so important that we do talk about addiction and that there's no shame associated with this because it is a disease and it's been identified as a disease by the American Medical Association. But I think that it would be a shame if we don't understand what the disease is all about, particularly for families and importantly for the family member that is suffering with the illness of addiction. It's a lot of genetic predisposition, and that could be on the paternal side, it could be on the maternal side, it could be an aunt, it could be an uncle, it could be a parent, it could be a grandparent. Just like any other major disease, when you go into the doctor, they'll ask you for a family history. Is there a history of hypertension? Is there a history of heart disease? Is there a history of cancer? And the reason they ask you that is because you can inherit that gene. Now, you might carry that gene but not display the behavior, and it's much the same. It is the same with addiction, and it's very rare that you'll be asked. I mean, it's becoming more in the mainstream where they are asking about, the history of addiction. They're very concerned also too about how much you are drinking and, of course, using any other drugs. But what happens for the person that is abusing or addicted to a chemical is that the brain gets hijacked. And when I say the brain gets hijacked, is the dopamine goody, which is the pleasure center of the brain, appears to give the addict and the alcoholic way more of a goodie than a person who does not have the illness. So, one or two drinks might be enough for the average bear. Like by the second drink, you're going, whoa, this is really affecting me. But the person who has a disease of addiction, since it is progressive and it does release a lot of dopamine in the pleasure center, it becomes almost like a reward or reinforcement for them, particularly the alcoholic. It brings temporary happiness. It reduces the level of anxiety. But along with that, since alcohol in particular is a central nervous system depressant, and you have the depletion of the dopamine, it's the old saying, what goes up must come down. And that's what we're dealing with is, people want to stop, but they don't have the capacity to stop because of the way they're physiologically set up for this dopamine goodie. And then along with that, it interrupts the serotonin receptors in our brain, which control our mood. So, think about that, ingesting a central nervous system depressant and then depleting the dopamine. And so you get to a place where it's like, oh my goodness, I need to take a drink to feel better. So it almost becomes maintenance drinking. And it's much the same with drugs too. People get the high, the euphoria associated with using other drugs of choice. And, they get the euphoria, and then once they stop using, they come back down. So it's kind of a no-win situation for those who have the illness and aren't willing to seek help. Back in the year 2000, when I went to Betty Ford, the counselors of the doctors, said to me, you're an alcoholic addict and you can never use again. And my immediate response was, well, prove it to me. Well, back then we didn't have a lot of scientific proof, like in terms of, how it affected the brain, and today, the disease, since it's so prevalent in our society now, I mean, we see it in the headlines all the time, we are able to do more research. Now we can do MRIs. At the University of Pennsylvania, they came up with an MRI where they can actually peek inside the brain. And the brain has, a go system and a stop system. And the go system is what we call the impulse system of the brain. And the stop system is the adult rational side that weighs in and says, hey, maybe this isn't such a good idea, or maybe I need to stop. But what happens, and we've seen in this MRI, when the person who has the addiction problem is exposed just for little snippets to their drug of choice or alcohol, that the brain lights up red, which is the impulse side of the brain. So it's go, go, go. And it's the adult rational side doesn't even weigh in. And so, the next thing you've relapsed or returned back, to the drinking. We also have another very, very interesting study that was done by a woman, Dr. Virginia Davis in Houston, Texas, who needed fresh brain tissue to do brain cancer research, is what she wanted to do. And so she wrote with the Houston Police Department, and they picked up known winos and alcoholics who had passed away from drinking. So she had fresh brain tissue. But when she started sectioning their brains, they started to find, or she found, large amounts of tetrahydroisoquinone. I call it THIQ because I can't spell it, but
that's me too.
Yeah, that makes no sense. These people were not using heroin. They were not taking, pain medication. Why is this that this main ingredient of heroin, is in the brains of these people who, had an alcohol dependence? And so, tests were done on the poor little rats, introduced them to water and vodka, but they injected them with this THIQ, reintroduced them to the vodka, and they drank themselves to death. And the next thing they did was took the closest thing to us, which is a male adult ape. The same story, injected him with a specific amount of THIQ, did not let him drink himself to death. And, subsequently, when he died of natural causes, she sectioned his brain, and none of the THIQ had dissipated whatsoever. So then people with 20 and 30 years of documented sobriety donated their bodies to science. When they sectioned their brains, they found large amounts of this THIQ. So, it's a long explanation, but the reality of it is that people who have an addiction problem metabolize alcohol and drugs differently than the person who does not have an addiction. So if you think about the diabetic, people who are diabetic metabolize sugar differently than people who are not diabetic. And so the experience then with that is that this THIQ needs to be fed more and more to get the same desired effect in terms of dopamine release. So I know Di and I, in our clinical experience, as we move into coaching and clinical work in the state of Florida and then coaching outside of the state of Florida, have found that people who do go into remission, 100% of the time when they return to drinking and have this delusion that they can drink normally or they can drink less, not 90% of the time, 95% of the time, 100% of the time, for people who truly have the illness, they always return to the level they were at or more. So, the neurotransmitters in the brain all get out of whack. And so, once they cease and there's an intervention, if you will, to stop the behavior, the brain starts to heal. And once we try and figure out what's going on, I think you can talk about dual diagnosis, because that may play a big part. A lot of times we say the drinking or drugging is but a symptom, of something else. So, Di, you want to speak to the, since you're a licensed clinical social worker and a master's level certified addiction professional, what you see, in your counseling of patients that have the addiction, in terms of, other things that might be going on in terms of what we call a dual diagnosis.
Absolutely. I mean, I'd be delighted to. But one thing, first of all, thank you for that wonderful explanation. I just want to button that up a little bit with the family stuff, and then we'll move into there. But isn't it true, or, in your experience and from the studies, my understanding is that the parental side, the paternal side of the family genetics, if you are a man and you happen to be the son of the parental side, you have a much greater likelihood to actually see the disease expose itself, right? And so I just wanted to make sure that I understood that correctly in my studies, but I know you've worked with that, and it does kind of bring back that genetic linkage that makes people so, afraid that they're going to get it. What I do want people to hear before we answer that is that this is a disease that's treatable. It's 100% treatable if people do what's asked of them and they have a desire to. So that's, we both talk about it all the time. If we had to have an addiction, had to have a disease of some kind, this is the one to have, because we can arrest it, 100%. But is that an accurate statement?
Yeah, I'm glad you brought that up, Di, because I skipped over that, but it's very, very important. So for males on the paternal side, if their father or their grandfather are just going up, that lineage or that line, are 8 times as likely to display the behavior. So for those males with the gene, there's a higher propensity for them to either drink or drug. Addiction is addiction, drug of choice is drug of choice. But in a lot of ways, the cards are stacked against them. because there is a strong genetic predisposition, and it's very important that you brought that up. And it's rare that we see people who know their biological family history that we don't see some sort of genetic predisposition. There's people that have been adopted, and so we don't really know a lot about their families, or they don't, their families of origin. So, but most likely, there was probably some sort of genetic predisposition with some member of the family on either side. But yeah, that's a real important point, and I'm glad you brought that up.
Well, and I'm glad you were able to define it a little bit better. So thank you for that. Yeah, we were talking about the mental health component of this. There's so many addicts and alcoholics that really, it all started off as kind of not what they were intending, right? I don't think anybody grows up and goes like, hey, I think it'd be really great to become an addict alcoholic. That'd be a lot of fun. And I'll see if I can screw up my whole family. That would be great. Good times, right? But a lot of people start off with, conditions such as anxiety, or depression, certainly traumas. But even things as simple as like just not feeling really good about self, low self-esteem, and social anxiety, things like that, where taking a drink or two, or maybe just, popping a little pill or smoking a joint or something calms them down in a way that we, refer to as self-medicating in our world, right? Which is people trying to figure out how to get rid of that feeling, but not really talking to anybody about it and trying to figure out the why. Rather, they think they have it, and then all of a sudden, they're in a situation where the feeling of discomfort was eased, and, these underlying issues are now masked, and then it becomes, like their worst nightmare. And instead, we highly recommend that people get some help, because once we start to discover that either, through medication and behavioral changes, et cetera, that a lot of times these underlying symptoms that start the whole feeling of I can't deal with life, so I've got to, self-medicate. Once they learn how to deal with whatever life problems are happening, or that feeling of anxiety or depression, certainly going through a trauma with an expert. Now we have tools and techniques that we can use to deal with those rather than feeling like we have to self-medicate. So, it's a big one. You and I deal with that on a daily basis. I don't think in my years of doing this, and I'm not sure about you, but I don't think I've ever come across somebody that doesn't have a dual diagnostic approach to this, which is there's something going on that they have, and usually it has to do with depression and anxiety. That's a big one, and traumas. So, we know there's other factors that can affect the likelihood and speed and development of addiction, things like peer pressure, right? For sure. When you're younger, that's a big one. But a bigger one than that, which is you and I talk about a lot, is, the actual environment that somebody grew up in, or the environment that they're living in. So what, thoughts about that?
Yeah, there's kind of flipping back to what you were talking about in terms of a dual diagnosis. I mean, probably most people that we see have some form of dual diagnosis, and that can take the form of, some severe mental illness like, schizophrenia or bipolar, or, childhood trauma that you spoke about. But the majority of people, to reinforce what Di said, is some form of anxiety or depression that we see, and the self-medicating of that without speaking to somebody about what's going on, underneath, is very, very common. And so the ripple effect for the family is it's so frustrating. In other words, if you had a friend or a loved one that was in the hospital for some other disease, God forbid, like a heart attack, or, treatment for cancer, people have a tendency to be sympathetic, empathetic, you get cards and flowers. But this addiction thing, family members will look at it and say, why are they doing this? Why don't they just stop? And really it comes down to sometimes they're very judged, or very much judged, as bad people, people that, have, low morals and, or they're lazy or whatever. But, in the course of our practice of over 20 years, we've seen every walk of life. This disease does not discriminate. I don't care what you do for a living, whether you're a judge, lawyer, doctor, pipe fitter, homeless, unemployed. It doesn't matter, just like other diseases. People, because of what they do for a living, are not immune to hypertension. So that's really the way we need to frame it and see it. But for family members, saying there, okay, it is a disease. It's not a pass, that they can go ahead and just continue what they're doing because they have the illness. And as Di said, of all the diseases out there, and there is fabulous treatment, where you come in from a holistic approach, dealing not only with the addiction, but the underlying reasons as to why people might be using, and understanding the genetics of family, and environment, and trauma, and all those things that go hand in hand with things that might reinforce for the addict or alcoholic relief from what's going on in terms of, a temporary happiness and a reduction in the feelings that are uncomfortable. So, yeah. So it's a treatable disease, and that's what we need to remember. But as Di said earlier, you can go to the best treatment facility in the world. You can have the best counselor in the world, but all the addict has to do is have a little bit of willingness. I guarantee you that most people that we see intellectually know that what they're doing is a problem, but until their head and their heart connect and say, wow, I am an alcoholic or I am an addict with no shame, and I'm going to seek help, that's 95% of the battle. So that's what we want to emphasize, and how that person gets to that place. Really, it can be all over the place. But if they're trying to do it for somebody else, it's probably not going to work. But once they want to do it for themselves, there's a great chance that they're going to get into recovery and stay in recovery if they take the suggestions in terms of continuum of care, and be open to suggestions.
Yeah, I love it. Just to kind of piggyback on that just a little bit, is just, the statement that is so important for people to hear, and you said it, which is this disease does not discriminate, right? It is not a moral failing. It is not about being a bad person. It is not about being, something that I want this to happen to me. This is a disease like many others. We were started to talk a little bit about environment. Environment also plays a huge part in all of this, right? If I grew up in a family where there was an absence of love or support, maybe affection or direction where I can lead into my life, sometimes the people that I choose to hang around with, I was talking about peer pressure earlier, can start the ball rolling at potentially a very young age, which is also another huge factor, right? If I start using at a very young age, there is a much higher probability that I'm going to become an addict or an alcoholic. So the environment that we live in, really, does make a difference. And it's not just the socioeconomic, factors there, although that does also play a little bit of a part. If I'm from, a lower socioeconomic class and I am in an environment where the community itself lives and breathes by drugs and alcohol, and, the dealers on the street corner, I'm going to have a greater chance of having that situation occur in my life. So, the other thing that's so important to understand is the type of drug that I'm using. We know that the studies have shown that if there's people that have taken, a drug like methamphetamines, cocaine, crack, etc., that they can get addicted like immediately. It's one of those very powerful, depending on who you are, and they get addicted very, very quickly. So there's a lot to this disease, but the bigger part that I want to kind of discuss for just a couple minutes is we know the disease, the addiction part, which I'm hoping by our description today, the family can then understand a little bit more about it. But what we need to discuss a little bit is that we know, even though they get it, by this, it helps them be a bit more compassionate. But we also know that the addict themselves can cause a great deal of destruction in the family, right? So it's like the white tornado going through the house and just annihilating things. And the family becomes so weak and so unsure of what to do and how to do it. Our hope is to, by explaining it a little bit, they have the compassion, but that doesn't mean they don't need help themselves. Once we start, because remember that their addiction is the addict, or the alcoholic. And they really do, as my own personal self, I know from my life experience. And when I was in the throes of the family side of it, I mean, it was like I was obsessed and possessed by this whole thing. And I couldn't get it out of my head, and I needed to try to fix it until I learned some tools and techniques to, cope and to be able to realize that I was not alone in this journey. So, people like, healing families, people like family and addiction experts like ourselves that people can reach out to and get some information is very helpful. They need to know that there's sources and resources out there. So, I know you are a great person in letting them know where we can get some well-deserved help and needed help, right, Bea?
Yeah, it's, of this disease, it's just for the families, it's so hard to make sense out of something that almost to you doesn't make sense. And so it's easier to get into a place of acceptance with somebody that's in the hospital with some other disease. But with this one, it affects the family as much, if not more, than the person who has the illness, in terms of ruminating, anxiety, worrying about who's coming through the front door, where they are, what's the next phone call going to be. But, and that's why Di and I decided that, there really isn't enough time being spent with the families to help them navigate through this whole process. So, if you go to our website at www.familyandaddictionexperts.com, we have some resources on there for families, that's in a PDF file. You can download it and take a look at it. But also you can contact us, a couple of ways. The first way would be to send us an email at info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. But our website, if you go there, you will also see a form that you can fill out, and that will come right to us, and we can set up a consultation with you that's free of charge to find out what's going on in your family. So every family is different, but if we can get some specificity as to who's being affected, who the players are, and how can we help, and if you feel comfortable with us, we can move forward from there. We're also on Facebook and Instagram. So, a couple of old timers are learning a lot about social media.
Boy, are we.
I guess that's the world we're living in, and that's okay. So, I've enjoyed this, Di, speaking with you. It's, something that we've lived and practiced in for, a couple of decades. And, we love what we do, and that's important. And the patients and the family or clients always come first. And that's what it's all about. We're here to help in any way we can.
Absolutely. And, there's nothing that is a greater feeling than to see a family come back together after they learn some information about this disease and also how to cope and deal with the disease. So for us, that is the greatest win we ever have, is when we see, someone several years later and they're awesome and better than they've ever been. So it's possible. There's a lot of hope here. Certainly, like Bryce said, feel free to shoot us a question of any kind. If we can't help you, we will try to find a source that can. Anyway, we really appreciate your time. I hope this was a little bit helpful for you guys today in understanding a little bit more about addiction itself and just what addiction is. We show up every couple of weeks on our podcast, Healing Families Shattered by Addiction. We'd love to hear from you, and we look forward to being back in a couple of weeks. Thanks so much, and happy Thanksgiving, everybody.
Yeah, happy Thanksgiving.
Talk to you soon, Bea.
All right. See you, Di.
thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.